Welcome back to ALH 8, Chapter 11, Part 2 lecture series. This is the second of that lecture series, so we are on Chapter 11, Part 2, and this is the second lecture for that. So here I was saying that because it is given under the epidermis, this looks like it's pretty deep. Like you get the idea when you're looking at the picture that you have this big long angle underneath. And in reality, it's more sitting up in here, and the needle is not this long of a width. And then you can see here how the wheal forms. So the intradermal injection is administered just under the epidermis. The drug is dispensed in an area where many nerves are present. So therefore, it causes momentary burning or stinging, and that is something for your patient to expect. It's a minute amount of medication injected, and the method is used to test for allergies, drug sensitivities, and susceptibility to some diseases. Here are the locations. Again, we said upper chest, forearm, which is what we'll be using in our injections, and then upper back. So upper back is most commonly used in allergy testing. Have any of you ever had allergy testing? Yeah. If you're allergic to a ton of things like I am, it can be a bit uncomfortable. So we're moving on to subcutaneous injections, the SQs or sub-Qs. And these are given between the epidermis and the muscle into the fatty area called the adipose tissue. Smaller doses of less irritating drugs, no more than 2 milliliters. So subcutaneous injections, you know that you're going to be injecting no more than 2 milliliters, of that medication. And the angle insertion is a 45-degree angle. So subcutaneous, 45-degree angle, no more than 2 milliliters of medication. And for multiple daily injections, you want to rotate the sites to prevent tissue damage. And you can keep a rotation record so you know where the last one was injected. The posterior upper arm is the typical injection site, but the abdomen, the anterior aspect of the thigh, and the upper back may also be used. So you can find these figures in your book, 1117 on the left. This shows how a subcutaneous injection works. And again, so now we're past the epidermis, the dermis, and we're into that fatty tissue there. And that's where the SQ should go. And then on the right shows the common sites for the sub-Qs. Again, we will be using the upper outer arm here. And I listed these in the last slide, so I won't continue to do that. But you can find that on 1118 in your book, figure 1118. And I also had mentioned keeping a record of rotation sites. So this is what a rotation site log looks like. Right arm, right abdomen, right thigh, left abdomen, left arm. And that way you can kind of rotate the sites and not give into the same location and damage tissue. Moving to intramuscular injections, these are given if a drug would irritate the subcutaneous tissue, or if more rapid absorption is desired. Large volumes of medication can go into the intramuscular injection because that muscular area is larger, so it can take more medication. The angle of insertion is 90 degrees. The angle of insertion for intramuscular injections is 90 degrees. The preferred sites in an adult are the vastus lateralis, the deltoid, the ventrogluteal, and the gluteal medius muscles. So what is preferred injection site for an infant or child? What is preferred injection site for infant or child when we're talking about intramuscular injections? What do you think? Hopefully you're writing that down to submit to me in class. The answer is the vastus lateralis. It's important to select a needle that is long enough, especially for obese patients, to ensure that the medication is injected into the muscle and it's not deposited into that adipose tissue, into that subcutaneous area. The recommended gauge is 20 to 23. So that's a smaller gauge, right? So that's going to be larger. And the needle length should be 1 to 3 inches depending on the patient's size. When locating a site for an intramuscular injection, you want to expose the site so that you can see and palpate the landmarks correctly, and avoid sites that are too close to large nerves, bones, or blood vessels. And this is really important, especially when you're looking at your gluteal injections, and we'll talk more about that in lab. Procedure 11.8 in your book describes how to give the intramuscular injection into the deltoid. Next slide here again is similar. It shows that it goes through the epidermis, dermis, the subcutaneous tissue, and into the muscle. And on the right here, you can find this as figure 11.21 in your book, and those are the proper intramuscular injection sites. Let's talk about the deltoid and the vastus lateralis sites. So the deltoid muscle is the muscular cap of the shoulder. It's located at the top of the upper arm, and it can hold only 1 to 2 milliliters of medication. I want you to remember that. So the deltoid can hold only 1 to 2 milliliters of medication. The injection site is 2 finger breadths below the acromial process. And we'll talk about what that looks like, obviously, and we'll be practicing that on each other. The vastus lateralis is part of the quadriceps group in the thigh. It is the safest IM site for infants, and that's why it is used in pediatrics. There are fewer nerves and blood vessels to avoid, and here it's 1 hand width below the proximal end of the greater trochanter, and that's in adults. So only in adults, 1 hand width below the proximal end of the greater trochanter. And we'll talk about peds also. We'll look at it on a baby because it's a lot smaller area, obviously. So for a deltoid injection, the patient must be seated or lying down. So it's important that you make sure that they are either seated or lying down when you give it. Any site selected for infants and children involve greater risk of error because the muscles are smaller than the muscles of adults, right? So we have a smaller area to work with. And infants should be restrained by either a coworker or a parent to prevent injury. And this is really going to be based on how the parent is reacting and interacting. If the parent is worried and upset, and you can tell that they're visibly nervous, then you want to ask a coworker to help with the restraint, because that helps the parent be more at ease and not feel guilty if the child is, upset with them. And a lot of times parents, though, they come in, they're very helpful, and they know it just has to be done. And in that case, it's really nice to have them give you a little bit of help, especially in all cases, you want them to help you distract the child so that it can go more easily. The recommended site for vastus lateralis injections in infants and children is below the greater trochanter of the femur, but within the upper lateral quadrant of the thigh. Okay, so I'm going to say that again. The recommended site for the vastus lateralis injection in infants and children is below the greater trochanter of the femur, but within the upper lateral quadrant of the thigh. And again, without being able to visually look at this, it's much harder to understand. So we will definitely look at this in lab. Procedure 11.9 describes how to administer a pediatric intramuscular vastus lateralis injection, and you will be making a procedure card for that. And here we have the samples of the intramuscular injections in figure 11.22. That's on the left here. This is a deltoid site. Okay, and in figure 1123, that's here on the right, this shows the recommended injection site for the vastus lateralis. And you can find these in your book. So we have two gluteal sites. We have the dorsogluteal site and the ventrogluteal site. Now, years and years and years ago, up until not too long ago, dorsogluteal was used. So if you're working with someone who's been in the field a long time, they probably use dorsogluteal. Now, ventrogluteal has come along, and it's a little bit of a safer area to give that injection. And for example, Dignity now really requires to do the ventrogluteal, and a lot of the people that come in to do their testing and that they hire are not even aware of the ventrogluteal sites. So that's one of the things that our industry has said, hey, are you teaching that? And we're like, yeah, we are, whoop, whoop, because we want you to rock it, right? So the dorsal gluteal region is the traditional site for the deep intermuscular injection. There are common sciatic nerve injuries, and these occur if the site is discouraged. So that's one of the reasons that they've moved away from the dorsogluteal, because you have that big sciatic nerve there. The ventrogluteal region uses a larger mass of the gluteus medius muscle. It's free of major nerves and blood vessels, and it's considered safe for both infants and adults. For children, you will need about an inch needle, whereas for an obese adult patient, you may need up to a 2.5 to a 3-inch needle. So you can see how much that varies in size. All right. How do you locate where to administer the ventrogluteal injection? So what I really want to know here, what I want you to write down is, what position would you put them in? And what do you use in order to locate it? You can pause it here. You can write just a small little note there, but go ahead and write it down for me. So to locate the site, place the patient in a Sims position and put the palm of your hand on the greater trochanter of the femur. Pointing your index finger toward the anterior iliac spine, spread your middle finger back as far as possible from your index finger to form a triangular injection area. I'm going to say that one more time. And I'm hoping at least that you put the patient in the Sims position if you've done your reading, and that you use the palm of your hand on the greater trochanter. That's really the biggest piece I was looking at for you to know so far if you've done your reading. But I'm going to tell you that again, okay? So to locate the site, place the patient in the Sims position, put the palm of your hand on the greater trochanter of the femur, pointing your index finger toward the anterior iliac spine, spread your middle finger back as far as possible from your index finger to form a triangular injection area. And again, you're visual. Don't worry, I have visual coming. You can look at 11-10, and this talks about how to give a Z-track intermuscular injection in the dorsogluteal site. And a Z-track is where we move the skin over and then we release it back when we give it. Here's your visual, okay? So here's what I was telling you right here. Can you see how the hand's there on the greater trochanter? Can you see the triangle here? So hopefully now that I said twice and now you can see it, that helps it in your mind. And then here you can see this nerve. Look at that nerve running through here, and you can see how this could be easily compromised. So you can find both of these figures in your book. This one is 1124 and this one is 1125. So talk a little bit about the Z-track. So the Z-track intermuscular injection, it displaces the upper tissue laterally before the needle is inserted. You palpate the site using anatomically correct markings and localize injection site visually. So you want to make sure that you're in the right site, again, because we're talking about dorsogluteal. You insert the needle into the anatomically correct location and slowly release medication into the deep muscular tissue. So the medications for which Z-track injections are appropriate for, they require a large muscle mass, and they should be injected only into the dorsogluteal site. Medications that require the Z-track method of administration might be heparin. And it's important to remember also that we do not